Are there any foods to heal the joint cartilage?
No, sir, there are no foods that can heal the joint cartilage, in fact. But as I already said, as cartilage is avascular, the only blood supply or the nutrients which cartilage gets is from the synovial fluid. Whenever the movement happens, the pressure and the removal of pressure creates the entry and exit of this nutrients from the synovial fluid.
So tell me, what is synovial fluid?
Yes. Synovial fluid is like a thick fluid which is in a joint, like enclosed in a space, like this room full of fluid, which eases the cartilage movement. It nourishes the cartilage for the smooth movement.
So this is a joint. The fluid is surrounding the joint, and cartilage is here. So you're saying that the nutrients to the cartilage is based on the fluid in between.
Exactly, sir.
And does that fluid amount goes down as we age?
Definitely, and the quality of it also goes down.
Okay. So, Dr. Devdas was mentioning that if you have a family history of osteoarthritis, you are at increased risk. So many of our mom and dad will have joint pain.
Yes.
So you are saying that cartilage even have a genetic predisposition to it.
Yes, sir. Definitely, there are a few instances where the family history has been established.
Yeah.
And moreover, many of us abuse our knees. For example, me.
How do you abuse your knees?
I did abuse. So earlier I was overweight. So I did not have much knowledge on muscle mass, workouts and all. So I started running. After running, I lose 6 to 7 kgs or hardly 8 kgs. And then I feel, okay, now I'm okay. And then again I gain weight. Again I do that. So like that 3 to 4 times I did, sir. So if at all, if I
So
can
like
say...
you dieting kind of thing, you gain weight, you
Yes.
lost weight, gain weight.
and through running, not just muscles, workouts and all. Running, cross trainer, only this. So if at all, if there is some power in the universe which can make my knee cartilage into a human and talk, if at all I am the knee cartilage, it would abuse me. Literally, boss, why did you do all this? These years, it was very stressful for me, it would be saying.
Is running bad?
Running bad depends on the person. For example, ideally, your knee joint would be happy because your ideal weight and you're little muscular. Muscular in the sense there is good muscle mass rather than fat. So knee joint, first of all, knee joint formation and cartilage thickness is important. Once it is formed well in our growing age, after that, these muscles act as bodyguards for the knee joint cartilage.
So I'm summarizing. So bones, synovial fluid, cartilage, and surrounding the bones is the muscle. Muscle is acting as a guard. Okay.
To simplify this, for example, if we see, we can compare this to our car tires, sir.
Car tire.
Car tires. You bought a new car, I bought a new car today. You are driving 10 kilometers per day. I am driving 100 kilometers per day. After 1 year, we both bought same time.
Yeah.
But that tires and this tires are not okay because I abused more. Maybe other parts like drifting and sudden braking, off-road. So these are, I'm giving the example just.
Nice.
So it all depends on not the starting time, but how you
used it.
Even knee joint implants also work that way, sir.
But is running really bad for the knees?
Depends on the personality, sir. If they are overweight and obese, yes.
What happens when they're overweight? There is extra pressure on the knees.
Exactly. Sir, ideally, when we stand, for example, my weight is 80 kgs if we imagine. Each of my knees will be taking, when I stand, it will be around 65, divided 32 something. But when we walk, each knee joint will be taking 2 to 3 times of my weight, which is 80 into 2 to 3 times. Because at an angle, when the, not only pressure, it's not straight, I'm not standing straight, right? When the movement is happening, the forces on it doubled. And when we climb the stairs, it is like 4 to 5 times. 4 to 5 times. So these people who do not work out in the morning, whenever they go to the office, they think that, okay, we'll climb the stairs and then we are doing something good. But they are damaging their knee joints because forces are high.
Oh my! So you are telling me that when patients are overweight and obese, it is better not use as a running as a measure to lose
the weight.
Maybe it could be a little bit, but not the main one.
Yes, I learned it the hard way. I think many learned it the hard way who are proposing.
So what happens? Okay, let's say you are obese, you want to lose weight, and they do walking and running. We'll come to the walking later,
Yes,
but
yes.
they do running. So they put extra pressure on the joints.
Yes.
So that will worsen the existing arthritis.
Exactly, or it might start the arthritis. It might start some small injury or crevice in the cartilage, and that will
Have you seen
propagate and
patients
prolong.
like that?
Definitely, sir. You might have heard David Goggins.
Yes.
David Goggins, you might be knowing, right?
Yeah, David Hawkins, for people who don't know, you should definitely Google him. And there is a very inspiring interview where he has all kind of problems, but he still runs.
Yes,
But he has a lot of fractures.
definitely. Yes, sir.
So why did you mention about David Goggins?
Earlier, he was obese. And then someday he decided that he has to change his lifestyle. Then he started running. But it was all of a sudden. And he started running, but he continued. He did workouts also, but later on, I guess, that's the reason his knee joint slowly started wearing off. And he did a lot of marathons. There are a lot of records on his name. But ultimately, he underwent surgery, which is knee alignment surgery. We can find it in many podcasts also. So, proximal tibia, they alter the alignment so that the medial joint cartilage would not wear off. For
So
him.
what does it mean? Tell us in simple terms.
Sir, ideally, when a knee joint is like this, usually medial side, which is inside of both knees, gets worn off. So for him, that happened. So they slightly changed the alignment. That surgery they did.
Because of repeated running.
Exactly. So it's like our tires, sir. It doesn't have any emotion. Our knee joint cartilage do not think about our endorphins and adrenaline when you do a marathon or at least half marathon. So people are, I don't know, in India specifically, walking is sacred somehow.
Correct.
They avoid exercises.
Yes.
But I've seen a lot of videos, sir. You are now doing strength training and all. That's a great thing. But most of us learn it the hard way. Like even me, I started strength training later on after realizing that I'm gaining weight very quickly. So I'm
What is your take on walking then?
walking actually is less stressful on the knee joints than running.
Okay.
But the problem is, for example, my mother, she goes down in the community, she walks with her friends, chit-chatting and all. And then after some time, half an hour or 1 hour, she feels like, oh, I did very good exercise and she is happy. But not for your knee joints. Instead of that, you can sit, do few exercises where you can squeeze your calf muscles like calf raises and all, where the blood is equally pumped. And instead of walking, putting the time in walking, you can do some exercises which can strengthen your knees. And you can do exercises sitting there which will improve your circulation, like calf raises or extending the knees and all. But they, because of the endorphins or I don't know, the chit chat with her friends, they will do walking. I asked her to start cycling. She has already osteoarthritis. I requested her, do cycling, do exercises. No, they won't do. Somehow they feel walking is the...
How is cycling better than walking?
While walking, the knee joint is taking the load. While you stand, the knee joint is taking the load, which as we spoke, 30 kgs it is taking. While we cycle, it is only the movement. Movement and actually more muscles are functioning in cycling than walking.
Is that the same as treadmill versus
Treadmill
elliptical?
is same. Elliptical is little
Less.
less stressful
Stressful
because
on the
we
knees.
use the hands also. But cycling is better, sir. For young patients, for my young patients who are in 40s and who want to lose weight and strengthen their muscles, I suggest swimming or else cycling. First lose your weight, become fit, and then you walk or run or go do marathons on states.
Wow. See, that's a very important point because many patients who are obese, who starts having pain in the knee, go to the doctor and they say that lose weight, your knee pain gets better. The first thing that they do is walking.
Correct.
So walking can be a part, but that could be the only part. So you need to include strength training exercises surrounding your knees.
Correct. Do the walking part, but also do the strength training part.
And one of the exercises that you said was the calf raising.
Where your calves are squeezed so that the blood is pumped up.
So a person listening to this podcast, if their mom or dad is having this problem, they could suggest them to lift the calf.
Like calf raises.
Calf raise.
So
And the knee extension.
knee extensions, simple knee extensions.
Simple knee extension.